What more on a policy level do we in the United States need to be doing?
Well, what we've got to do is make what you just said, Jake, uniform, not spotty. Everybody's got to do it. There's no excuse not to do that right now, because we know that can turn things around. I mean, that's the tool we have. As I've mentioned just recently, and as you alluded to, we have good news with regard to the vaccine. So there is light at the end of the tunnel. Help is coming. And that should, I believe, motivate people to just say we're going to double down and do this uniformly. Those are the tools we have right now, and they do work. We can get this to plateau and come down. We've got to, I mean, obviously everyone is sensitive to what we call COVID fatigue. People are worn out about this, but we've got to hang in there a bit longer, particularly as we get into the holiday seasons and the colder weather as we get into the late fall and early winter months. We've got to hang together on this, Jake, because we can make it turn around. We really can.
New cases are skyrocketing. We know that hospitalizations and then deaths ultimately follow. A University of Washington model projects that the U.S. will reach 439,000 deaths due to COVID by March 1st. Is that really possible? Another 200,000 deaths in just the next 4 months?
Yeah. It is possible, Jake, and the issue is the models, as I've said so often, are as good as the assumptions you put into the model. And we've got to change those assumptions. We've got to say we're going to turn it around by very, very vigorously adhering to the public health measures. And we don't need to get to that number. That's a model number if we act in a certain way. We can turn that around. That plus the fact that we're going to start getting doses of vaccines available for the highest priority individuals sometime in mid to late December. And then as we get into January, we'll get more vaccine doses available. I think when we put those two things together, vaccine plus strong adherence to the fundamental public health measures, we can blunt that. We don't have to accept those large numbers that are so terrifying.
Half of the states across the country, 25 states, have reported record hospitalizations this week due to COVID. Now, I know that you have said you don't think a nationwide lockdown is necessary, but given the numbers we're seeing, do you see any circumstances in the next few months where it might make sense for local officials, mayors or maybe governors, to issue new stay-at-home orders in just specific, discrete parts of the country?
I think that likely will happen, Jake, if we don't turn around this surge. I mean, you're right. We're not going to get a national lockdown. I think that's very clear. But I think what we're going to start seeing in the local levels, be they governors or mayors or people at the local level, will do, as you said, very surgical type of restrictions, which are the functional equivalent of a local lockdown. But we're not going to have a national lockdown. But, you know, if things really get bad and you put your foot on the pedal and yet still you have the surge, you may need to take the extra step that you're talking about.
Now, you've already encouraged Americans to consider canceling any Thanksgiving plans that involve visiting with somebody else or having visitors come. I know a lot of Americans are looking ahead, hoping to make plans for other holidays such as Christmas. But when do you think Americans will next be able to safely gather together for family events like this? Are you suggesting it probably won't be able to happen until, I don't know, Labor Day 2021, Thanksgiving 2021?
You know, it depends on a number of factors, Jake. For example, we have vaccines now. The first one that came out was highly effective. I anticipate that the second one likely will be comparable. You never can tell until you see the data, but would be comparable. That's great, but we have to get people to take the vaccine. So if we get the overwhelming majority of people taking the vaccine, and you have on the one hand an effective vaccine, on the other hand a high degree of uptake of the vaccine, we could start getting things back to relative normal as we get into the second and third quarter of the year, where people can start thinking about doing things that were too dangerous just months ago. But we've got to put all those things together, Jake. We can't just wish it happening. We've got to get the vaccine, it's got to be deployed, and we can't abandon fundamental public health measures. You can approach a degree of normality while still doing some fundamental public health things that synergize with the vaccine to get us back to normal.
So not until the second or third quarter of 2021, though. Christmas is probably not going to be possible.
Yeah, well, I think that if we get most of the country vaccinated in the second, third quarter of the year, and the vaccine continues to prove its efficacy and people adhere to those fundamental measures, I think we can start approaching the degree. It's not going to be a light switch, Jake. We're not going to turn it on and off, going from where we are to completely normal. It's going to be a gradual accrual of more normality as the weeks and the months go by, as we get well into 2021.
Mm-hmm. President Trump's administration is refusing to acknowledge reality. They're blocking the transition process with President-elect Joe Biden's team, including any transition related to fighting the pandemic. How problematic is it for the fight against the coronavirus if the NIH and your agency and other government experts are not able to begin communicating with President-elect Biden's team, which, as you know, has its own expertise in fighting pandemics?
Well, Jake, as you know, I've been through multiple transitions now, having served 6 presidents for 36 years. And it's very clear that that transition process that we go through, that time, the period of measured in several weeks to months, is really important in a smooth handing over of the information, as well as it's almost like passing a baton in a race. You don't want to stop and then give it to somebody. You want to just essentially keep going. And that's what transition is. So it certainly would make things more smoothly if we could do that.
So just as a public health measure, you think it would be a good idea if your team would be able to work with the Biden-Harris transition team right now, just in terms of what's best for the public health of the American people?
Of course, Jake, that's obvious. Of course it would be better if we could start working with them.
When is the last time President Trump attended a White House coronavirus task force meeting?
You know, it was months ago, but, you know, when we have our task force meeting, it's run, as you know, by Vice President Pence. And the vice president then translates that to the president himself. But the last time the president was physically at a task force meeting was several months ago.
President-elect Biden has selected Ron Klain to be his chief of staff in the White House. And partly the reason for that, he pointed to Klain's experience fighting Ebola in 2014. You worked closely with Ron Klain during that outbreak. What do you think of President-elect Biden's choice for chief of staff?
It's an excellent choice. I mean, I worked very closely with Ron Klain during the Ebola outbreak. He was they called it a czar. He never liked that word czar. He was the coordinator, but he was absolutely terrific at the Ebola situation, where we had a very successful ultimate end game with Ebola. We developed therapies. We put out the outbreak in it was a terrible outbreak, obviously. But we ultimately were very successful. But that's how I got to know Ron.
It's quite a contrast. In January of this year, Ron Klain wrote a piece for The Atlantic talking about what needed to be done for the pending crisis. This is in January. And the next month, Trump's acting White House chief of staff, Mick Mulvaney, was saying that the virus was just another hoax from the media. You don't have to comment on that. I am. Let's move on. I want to ask you about this new vaccine from Pfizer, which will be hard to distribute, challenging to distribute, because it needs to be kept at 75 degrees Celsius, and it will have 2 doses. Now, we're hearing from state officials, health officials in places such as North Dakota and Mississippi, who say they're overwhelmed, they're daunted. One added, "We absolutely do not have enough to pull this off successfully." How can it be that we're in November and state health officials are worried that they're not going to be able to properly distribute this vaccine?
Well, it's going to be a challenge, that's for sure. I know that the states, I mean, that's not something that I deal with in a distribution. Others do. But I can tell you, Jake, just from what I'm hearing, they feel they need more resources to be able to implement something that they had not done before, namely the special requirements. I believe it's going to be done, Jake. I'm cautiously optimistic that we will be able to get that done. We have a system, the distribution system led by General Gus Perna, who is going to be responsible for getting the material there. Obviously, locally, once they get them there, they're going to have to be able to distribute. And that's what they're going to likely need more resources for. As we're hearing, they're talking about needing considerable more resources to be able to implement that.